My name is Brian Kinney, and I'm a board-certified plastic surgeon in Beverly Hills, California, and I'm a clinical associate professor of plastic surgery at University of Southern California. I devote a significant amount of my time, maybe a third, to research, development, new businesses, new products. So yes, I looked at devices that are monopolar RF, I looked at bipolar RF, I looked at ultrasound heating devices and a number of others. I brought Renuvion into my practice because it does a number of things that other devices didn't do in a way that met the needs of my patients. And one was contraction along the jawline, an example in the arms, and then shaping the abdomen and the buttock and areas. When you have alteration of the muscle, aspiration or removal of fat, liposuction, you need that skin envelope to follow like the perfect dance partner. When those other tissues are modified, the skin envelope needs to follow. And the unique properties of the helium gas plasma, where you have a dual purpose, and dual function, you can get the helium ignition in the plasma zone, and then you get the RF conduction for a component of bulk heating. That is unique. And then its ability to localize, to spot treat in effect, is very, very helpful. It's really effective for the body. You see some result of tissue contraction on the table, and then you get that maturation process, which RF does such a good job at. Over time, 2, 3, 4 months, you get this just contraction that follows that envelope of the underlying tissues, and really it makes patients happy and gives us good clinical results.
My name is Dr. Leif. I'm a board-certified plastic surgeon. I'm in Beverly Hills in Pasadena. I've been in practice for about 15 years. All kinds of cosmetic surgery, breast reconstructive surgery, and non-invasive therapies of all kinds. Tissue contraction, I think, is, it's truly like the new, it's unobtainium, at least up until recently. And most patients over the age of 35, 40 can benefit from it. In my practice, I would say probably 50% of my patients could benefit from it. And most patients don't realize it's even possible. A lot of patients come in to say, can you do something about this? In the past it was no, or we have to do a lift, we have to remove skin. So this is what I've noticed with just the advance of technology in general. Every few years somebody comes out with something that is a game changer and really can help us get better results. Fortunately, Renuvion is one of those things. I guess the biggest hurdles for any technology is, are you going to make your money back? Is it safe, and is it effective? So the nice thing about Renuvion is the answer is yes to all of those things, and the learning curve is not so difficult. If you know how to do liposuction, you can pick this up pretty quickly.
My name is Paul Ruff. I practice in Washington, D.C. We're actually right in downtown Washington, D.C. in the West End. Renuvion has expanded what we can do surgically. That's what I will tell you. It has allowed us to push limits on tissue that we hadn't had before. Patients have fairly straightforward recoveries, and so they come back for new areas. It provides confidence in technology. They decide to try new things within the practice. So it really has opened a lot of doors within the practice. One of the things that I like most about M.D.FACS is their investment into the advancement of this particular procedure. They're all laparoscopic devices. They're really not designed to be put easily underneath the tissue. The new tapered tips, the side ports, the size diameters will allow us an ability to apply this in probably easier and hopefully safer ways, as well as expand what we can do with this. I think those are probably the most exciting things, and just the intensity with which the science team and the medical team are trying to drive the advancement of this it's amazing.
I'm Diane Duncan. I'm a board-certified plastic surgeon, and I've been in practice for 30 years. What I love about plastic surgery today is the rapidity of innovations. There's something new every moment, and just like with innovations in every other field, they're increasing, so you have to be increasingly selective about what you choose to participate in. The biggest reason that I was looking at Renuvion for my practice, because I had several other RF devices, is the speed. I had a recent influx of gentlemen in my practice, and usually big men take 8-9 hours. And of course, the longer the surgery is, the less safe it is. And so I wanted something that was fast, that was safe, and that gave consistent results. Renuvion helped me achieve my goals as far as speed of the surgery by reducing my operating time by about 40%. Patients are very happy because they can see immediate results. I have patients who will drive for hours to have Renuvion. In fact, I had a patient fly from Australia to have a perky lift with Renuvion. I have people from Lebanon and Brazil and London coming for the treatment. So if I'm talking to a colleague about the device, they focus on 3 things. 1, does it work? 2, does it make sense financially? And 3, can I differentiate my practice from the guy down the street with it? The answer to all 3 of those questions is a resounding